If you have ever seen phlegm in colors, maybe green, black, yellow, or pale, this could mean something. This actually is a sign, and many of these are signs that your body is needing help. Your respiratory might be infected, you might have a bacteria, tuberculosis, or maybe even bleeding could indicate some type of cancer. What do the colors of your phlegm mean? What does this coughing product actually signify? That's what I'm going to reveal to you in today's video. We've all had phlegm at some point, but the colors that we produce actually mean something. Green means a specific disease, black could mean an infection, maybe even yellow, clear, or certain types of shade could mean certain type of bacteria. And this could actually save your life. If you know exactly what type of phlegm you are producing, you could know if you're getting into maybe a cough, just a simple cough, or a flu, or you're getting out of an infection that is actually a good sign that you're not going to die. Believe it or not, there are some of these infections that cause a serious condition that would take people to the grave. And this is why it's very important to know exactly what type of color you're producing. And this is why it's important for you to know the colors you're producing so that you can treat the causes and know exactly what you're dealing with. Number 1, clear or white phlegm. The clear color we see in phlegm is one of the most common colors we can see, and it's actually one of the most inoffensive situations you can face. This is usually seen in people with allergic rhinitis, with some type of allergy, some type of situation where they are very uncomfortable with maybe the hair of the cat they have at home, or the rug they're using at home every day, or maybe some type of allergy with pollen, or any situation that is causing more of an allergy than you should really have. Your body's trying to get rid of this product or these triggers that you might have in your respiratory system, and it's producing just natural white or colorless phlegm. This is something quite common, and it's not something to be alarmed with, but in some cases could also mean that you have a mild viral infection that needs to be treated. Maybe a flu, maybe a condition that's just producing too much mucus, too much phlegm, and needs to be dealt with in order for this not to get worse. If you're having constant allergic rhinitis and you don't know what to do, you need to increase that immune system to make sure that it's not so receptive to any of these allergic situations that you're facing every single day. Look for something like Probilion, Immune Defense, Immunoguard, or even Ultra C1000 from Fineland at finelandvitamins.com. Number 2, light yellow phlegm. A light yellow phlegm could mean something just a little more serious than just a simple allergic rhinitis. In these cases, we're talking about maybe a bacterial infection, something that is light, maybe an asthma condition that someone is facing that obviously is making our lungs have to eliminate some of the bacteria that is causing a constipation inside our respiratory system. In this case, you're going to see a light yellow phlegm. Not a dark one because you're not dealing with a grave infection or something that is really serious, but something your body is needing to expulse and get rid of in order for that respiratory system to function properly. So in this case, you need to look for maybe an asthma, a chronic inflammation that is more common in children and is an inflammation of specifically the airways, your bronchi, and your lungs. In other cases, it could be a mild bacterial infection where the body is trying to fight this infection, and that yellow color indicates white blood cells that are being eliminated in the mucus or phlegm you're seeing. Number 3, a dark yellow or green phlegm. In this case, this mucus is a dark yellow or green, often with a strong odor. This happens because there's maybe a severe or prolonged bacterial infection, such as a sinusitis, an acute bronchitis, or a pneumonia. In some occasions, it could be very serious, and if you're seeing green phlegm and you're not still being treated, I would go to the doctor and have myself checked. Maybe it's pneumonia, a condition which can lead you to death if you're not careful. It can lead you to maybe weeks of unparalleled pain in the lungs or respiratory conditions that need to be treated the sooner the better, because if it gets worse, it might even lead to death. Be very careful. Now, in other situations, it could be a complicated viral infection, which may begin as a viral illness but then develop into a bacterial superinfection, which is also something that can happen. In other situations, even something worse, like a cystic fibrosis, which is a disease, a hereditary disease that produces thick mucus prone to infection that is more complicated to be solved than just a matter of seeing the doctor. It's actually something chronic that you're going to live with if that's what you're feeling and that's what you're living every single day. In any case, make sure your immune system is improving. With cystic fibrosis, you might need something more like D-enzymes or glucagon. But if you want that immune system up, look for Flufend Iron Defense Pro Billion, and Immunogard from Fineland at FinelandVitamins.com. Number 4, pink or red phlegm. Now, if you're seeing phlegm that is now changing in color, looks blood-like, right? Because you're seeing pink and red, this is a mucus with the presence of, yes, that what I just mentioned. It's blood, and this is not a good sign. In some occasions, it could be a pulmonary tuberculosis, which is an infection. It's a disease that comes from the infection of a bacteria that where its lodge is causing the leaking of blood, and then obviously your lungs are expelling that in mucus that you're seeing. Now, if it's something worse, it could even be lung cancer. Not a fun experience. As soon as you see maybe your phlegm that is pink or red, you should get yourself checked. In some mild occasions, it could be even a chronic bronchitis that is just causing just a little bit of blood, and you're seeing your phlegm and might go away with the days, but in any case, it's good to have yourself checked. Number 5, black phlegm. Now, dark or blackish mucus, thick and sometimes foul smelling, is common when it comes to being black. It has a lot to do with maybe smoking. Don't remember that when you're expelling what comes from your lungs, you're expelling whatever is in your lungs. And in this case, it could be tobacco. It could be what you're smoking. It could be carbon. It could be something you're using maybe to burn something in the yard, and your respiratory system is getting filled with all this carbon. This could also be one of the causes. In any case, it could be a severe environmental pollution. Chronic inhalation of industrial dust, soot, or coal can also be some of the culprits. This is not natural. This has to be treated, because if you don't, in the long run, you're going to see other conditions that are obviously chronic, because your lungs are not taking all this junk and all this powder any further and anymore. Don't forget to give this video a like button. Don't forget to share, and don't forget that coughing is healthy. It's not bad. The problem is that this cough or this mucus can come with certain colors that are indicating that something is not right. God bless and take care.